Hi, my name is Nadine Reis, and this is my presentation on reproductive health and incarceration in Canada. The intended population for this presentation are nurses and nursing students. An important concept to know about when talking about reproductive rights is reproductive justice, which aims to support equity in reproductive health across all populations. And in regards to those incarcerated, it recognizes that autonomy and choice are constrained by oppressive and discriminatory structures, including racism, colonialism, classism, transphobia, homophobia, structures that also shape and define the prison system. I will mainly be focusing on women in prison as my population in Canada. And so a study by Liu et al., as far as contraception goes, identified that 80% of women in prison identified an unmet need for contraception. A lot of them, if they had been on contraception prior to prison, might have been allowed contraception, but otherwise weren't granted access to it. And they felt like there was a lot of stigma and that there was a general notion amongst prisoner workers that if you wanted healthcare, you shouldn't have gone to prison and you shouldn't have committed crimes. There was a lack of follow-up care for IUDs that were given and an inability to access pregnancy tests. They were denied contraception a lot, and once they went back into the community and were more sexually active, there was increased rates of STIs and unintended pregnancies. They weren't connected with healthcare after release and sexual health services, and there was just a general lack of information present about sexual health in prison. A study by Reis et al. Screened inmates in Ontario for sexually transmitted infections, and there were higher rates of HIV, viral hepatitis, gonorrhea, and chlamydia than in the normal population. There were higher rates in women than in men. Over half were asymptomatic and could continue to spread their STIs had they not known. There was low acceptance of testing due to fear of confidentiality, stigma, and lack of trust in prison staff, so many people refused their screening. And there was just a general lack of access outside of prison to healthcare for these people as well, because a lot of them were from rural settings where it was more difficult to access care before entering prison. Abortion access is very important to reproductive justice because it can facilitate justice for structural, gender, socioeconomic, and age-based inequities, and can also help women escape intimate partner violence. There's no mention of abortion currently in the Commissioner's Directive on Health Services in prison, and other countries have standards regarding abortion access for inmates, but Canada does not. And transportation, staffing, and security might be barriers to accessing abortion, but abortion is healthcare, and more research needs to be done to identify accessibility for this population, and best practice standards and policies need to be created involving abortion care for inmates. So as far as pregnancy in prison goes, women are at higher risk for adverse perinatal outcomes. So for the newborn, this means there's a higher likelihood of them being small for gestational age, having more NICU admissions or longer NICU admissions, neonatal abstinence syndrome, which is when the mother is addicted to something during the pregnancy, and when the baby's born, they go through withdrawal, stillbirth, and rupture of membranes. Maternal health outcomes include higher rates of hypertensive disorders, gestational diabetes, HIV and viral hepatitis, which can be passed to the baby, substance use disorders, and postpartum depression. This slide will mainly be discussing Painter et al.'s study findings. The Commissioner's Directive for Healthcare in Prisons in Canada states that healthcare should be just as accessible in prison as it is outside of prison, but this has been found not to be true because women in prison have less access to pregnancy-related care than non-incarcerated women. There's an inability to access pregnancy tests, lack of timely perinatal care. One of the women in the study didn't have access to sanitary pads during a miscarriage, aggressive treatments from staff, lack of screening for bloodborne and sexually transmitted infections, and a lot of the mothers weren't informed of results of blood tests and ultrasounds and had to push to get images of their babies from the ultrasounds. And just in general, in comparison to outside of prison, there's a lack of exercise, sleep, and emotional support available. Not all mothers receive more portions of food, some of their friends stored away extra food for them so that they could meet nutritional requirements for themselves and their babies. And it was just found that the inmates felt like security was more important than care, and if a certain aspect of care or care facility was just not approved like security wise or was just too unsafe, then they wouldn't get the care that they needed because security was more important than their health. So bonding between a new mom and her newborn is really important for both of their health outcomes as well as their relationship and attachment. But unfortunately, most incarcerated women are only given 24 hours with their baby before their baby is taken away from them. One of the most identified concerns for mothers in prison is maintaining their relationship with their children, which can be difficult as a lot of prisons are farther away from main community centers. And also, when someone is processed into prison, it can take a long time for them to be able to call or video call family members, as it takes a while to be processed. There are some MCP programs, mother-child programs, that allow children to live with their mothers behind bars, but they have very strict criteria. This is in all 6 of the women's federal prisons, but there's been inequity because of the requirements for who is allowed to be part of MCP. It is immensely traumatic for both the mom and the baby to be separated, and also can re-traumatize people who've had to be separated from loved ones before when going into prison. There is also something called the Elizabeth Fry Society, which supports incarcerated women, trans, non-binary people through housing support, employment, and legal help, and they do help incarcerated mothers. Postpartum care was also found to be inadequate in Painter et al.'s study. Women were recommended to not breastfeed despite all of the health benefits to both the mom and the baby because it was too difficult to get the expressed milk out to the babies in the community. A lot of the women were forced to self-cope after pregnancy and miscarriage and weren't given access to counseling services. And they found that most of their care ended at birth and that they were only cared for when they were with child, and once the child was gone, no care for their mental state or their physical state was really completed. It's important to talk about Indigenous populations when talking about reproductive justice and keeping babies and moms together, as there's a big history of Indigenous children being separated from their communities due to discrimination. 50% of women in prison are Indigenous, and they receive discrimination from correctional staff, including higher punishments and more security. 52% of children in foster care are Indigenous, and their mothers may be more harshly judged by Child Protective Services. Anti-Indigenous racism, neglect, and violence are very perpetrated by institutions, so it's important to recognize institutionalized racism. There is something where commissioners of prisons may transfer Indigenous offenders to appropriate Indigenous authorities to allow them to remain in their home communities with their families, but it's not used often, unfortunately. And main prisons are often far away from Indigenous reserves, so it can be very difficult for Indigenous mothers to see their children and their families. Recommendations to make reproductive health more equitable in prison include regular screening offered for STIs in pregnancy, education on contraceptives in prison, access to contraceptives in prison, obstetrical and gynecological access to address increased perinatal risks for pregnant women, early identification of maternal substance use and mental health disorders in prison, postpartum care services, translation to community service after release, further research on abortion access for those in prison, as it's an under-researched field in Canada, and increase ways to keep parents and their babies together. So you may be asking what a nurse's role might be in supporting this population and supporting reproductive equity. A patient might come to you from a correctional facility into a maternity ward that you work on, and it's important to leave those biases behind and take a holistic approach and support that person despite all extraneous circumstances, and make sure that they're feeling okay both physically and that they're taken care of mentally in the hospital. and you can advocate for proper maternal treatment of them and support bonding with their baby before they're separated. If you go into research, you can conduct research on abortion services and reproductive equity, as it's an under-researched field. You can advocate for reproductive justice, support screening services in the community for STIs and pregnancy for all people. And if you're working in a correctional facility, you can push for change and support your patients in accessing the care that they need. And if you're a public health nurse, you could work with marginalized populations to help prevent incarceration and keep families together. It's also important to educate those around you to facilitate reproductive equity. And people will know that you're a nurse, and they'll know that you're knowledgeable on a lot of topics regarding health. So it's important that if someone is to ask you a question, that you understand reproductive health, contraception, and pregnancy services. Thank you so much for your time. If you feel that you need a touch-up on your knowledge of contraceptives and services that people can access, I've provided a document of local sexual health resources that include STI screening, pregnancy screening, contraceptives, abortion care, pregnancy counseling, and a bunch of other amazing services. So you can use this for yourself and also for others that you come across who want to know what supports are out there to ensure their own reproductive justice. Lastly, here are my references for both my sources and my images. Thank you so much.